Virtual Fracture Clinic. Simple carpal fractures.
Hi, I'm Tom Tressida, an orthopaedic consultant at the Royal Melbourne Hospital. At the Royal Melbourne Hospital, the Virtual Fracture Clinic is run by specialist orthopaedic consultants and advanced practice physiotherapists. In many cases, we can review your injury and provide care without you needing to come back into the hospital. This video will give you the information you need to manage your recovery. There are 8 small carpal bones in the wrist. The triquetral bone and the hamate bone are 2 of the most commonly injured. Carpal bone fractures are commonly caused by a fall onto the outstretched hand, particularly where the wrist is bent back trying to break the fall. You can expect to feel pain and may see swelling, redness, and sometimes bruising. When your wrist is examined, there will likely be a point of maximal tenderness over the fracture site. On an X-ray, when looking at the wrist side on, these fractures look like a little fleck at the back of the wrist. It is very rare for this type of fracture to need surgery. It will almost always heal on its own given some time and support.
Treatment.
The most common treatment is to support the wrist in a splint for 5 weeks to limit the movement in the area while the fracture heals. The splint should be worn at all times for the first 4 weeks. In the 5th week, it can be removed when sleeping and for exercises. It is important not to bear weight through the injured arm. This means no lifting, carrying, pushing or pulling for 6 weeks. Objects up to 250 grams, like a can of drink or a mobile phone, are okay, as long as it doesn't cause discomfort. Use your pain as a guide to how much you can use the arm in the first weeks of your recovery. It is not harmful to move your arm, though there may be some discomfort. Feeling very sore is a sign that you should rest more. Follow the exercises in the brochure to reduce the risk of complications like stiff fingers. This fracture is expected to heal in 6 weeks. If you are a smoker, this can slow healing time, so we advise that you cut down or quit. You will not need to come back to hospital or have any more X-rays. If after 3 months you still have pain or problems using the wrist, contact the Virtual Fracture Clinic or visit your GP.
Can I drive?
You should not drive for 5 weeks until you are out of the splint and can grip the steering wheel firmly.
When can I go back to work?
Getting back to work will depend on the job that you do. A desk worker may return in a few days. Someone who has a very physical job may need 6 or more weeks off. Speak to your doctor if you need a medical certificate.
Can I stay active?
You can return to playing sports or the gym after 6 weeks. We encourage you to stay fit in other ways. You should have near full range of motion back in the wrist, at least 85% of your strength, and little, if any, pain. A physiotherapist can help you with a return to sport exercise program. Start with the exercises in this video.
Care at home.
Hi, I'm Emily and I'm a physiotherapist at the Royal Melbourne Hospital. We're going to demonstrate wearing the splint and some exercises to help your recovery. Place the splint on the palm side of the wrist and fasten the straps as comfortable. You should be able to move your fingers freely while the splint holds the wrist still. The splint should be worn at all times for the first 4 weeks, including sleeping. In the 5th week, it can be removed overnight if comfortable. You can also remove it for a short time for hygiene. Rest your hand on a table and use a damp cloth or wipe, both on the splint and the skin. Make sure both are dry before you reapply. To keep the splint dry in the shower, wrap in a thick plastic bag and secure with tape. You may need to ask someone to help you. Wrist injuries can be very sore. You should make sure to rest and use the arm less, especially in the first few days. Elevating the hand above the height of the shoulder can help, especially if the fingers are swollen. It is also advisable to use an ice pack or frozen peas over the area to help with swelling and pain. Do this for 20 minutes, 2 to 4 times a day. Wrap your ice pack in a tea towel or cloth. Never place ice in direct contact with your skin. If your pain is not improved with rest and ice, you could try over-the-counter pain relief such as Panadol or Nurofen. If you are still very sore, consider an appointment with your GP to talk about other medications. After 2 or 3 days, start these simple exercises to help your recovery. You should do your exercises 4 times a day or more if comfortable.
Exercise 1. Finger range of motion.
Bend your fingers down like making a fist. Then open the hand out wide. Repeat this 20 times.
In a forearm cast, a hand opens and closes. Exercise 2. Elbow flexion and extension.
Bend and straighten the elbow. Repeat this about 10 times.
A model raises and lowers her right arm. Exercise 3. Forearm rotation.
Keeping the elbow tucked into your side and bent to 90 degrees, rotate your palm over and back to feel a mild stretch. Repeat this about 10 times.
Exercise 4. Wrist range of motion after 4 weeks.
After 4 weeks, you can add this new exercise. Remove the splint and bend the wrist forwards and back. It will probably be quite stiff at first. Just do what you can and it will improve over time. Repeat 10 times in each direction. Most people will recover their movement after 5 to 6 weeks. If you have stiffness or weakness persisting after that time, it may help to see a physiotherapist. You can see your own physio locally or contact the virtual fracture clinic to arrange a physio appointment at the hospital.
It's important that you understand these instructions. You're in charge of your own health. If you have any questions about your recovery, contact your GP or the virtual fracture clinic.
The Royal Melbourne Hospital.